Today we're covering an important health topic that affects thousands of people every year, pulmonary embolism, often called a PE. We'll break down what it is, why it happens, and how doctors treat it. This is an educational breakdown meant to help you understand the condition, not to give medical instructions. Let's get started. What is pulmonary embolism? A pulmonary embolism happens when a blood clot travels into the arteries of the lungs, blocking normal blood flow. This can make it harder to breathe and put strain on the heart. Pulmonary embolism is considered a medical emergency because it can get serious very quickly. What causes a PE? Pulmonary embolisms usually start with a clot in the legs or pelvis, often called a DVT or deep vein thrombosis. This clot can break loose, travel through the bloodstream, and lodge in the lungs. Common risk factors include long periods of sitting without movement, recent surgery, certain medical conditions, hormonal changes of problems. These risk factors don't guarantee a PE will happen, but they can increase the chances. Doctors say symptoms often include sudden shortness of breath, chest pain that worsens with breathing, coughing, sometimes with traces of blood. These symptoms can be serious, so anyone experiencing them should seek medical help immediately. Now, the question is, how do doctors treat pulmonary embolism? Now let's talk about treatment. The type of care someone receives depends on how severe the embolism is. But here are the major categories of treatment used by medical professionals. Blood thinning medications, anticoagulants, these are often the first line of treatment. They don't break up the existing clot, but they prevent it from getting bigger and help stop new clots from forming. Doctors monitor patients closely while using these medications. Clot-dissolving medications, thrombolytics. For more serious cases, doctors may use medication that breaks down clots more quickly. These are used with caution because they can have stronger side effects, so they're typically reserved for emergencies. A procedure to physically remove the clot. This might involve special catheters that can reach the clot and help break it apart. For people who cannot take blood-thinning medicine safely, doctors may insert a small filter into a major vein that we call the inferior vena cava. This filter catches clots traveling from the legs before they reach the lungs. Most people with a pulmonary embolism are treated in the hospital, so doctors can monitor breathing, heart function, and oxygen levels. Once they are stable, some can continue treatment at home under medical supervision. Doctors also focus heavily on prevention, especially for people who are at higher risk. Prevention may include staying active on long trips, following medical guidance after surgery, wearing compression stockings. And that's our breakdown of pulmonary embolism treatment. If you found this video helpful or learned something new, make sure to like this video, subscribe, and hit the bell for more clear and reliable health explanations. This video is for education only. If you have health concerns, talk to a qualified medical professional. Thanks for watching and stay informed.